Hi, I just want to talk to you about the different options you have to treat low testosterone or hypogonadism, or adult onset hypogonadism, as some people say. So it's broken down into short-acting, long-acting, and alternatives. Our short-acting agents, gels, they're applied to your upper chest and shoulder area once a day, and this most closely mimics the natural cycle because daily your testosterone peaks in the morning and drops off through the day. So every day you put on a gel, you have to wait for it to dry. That's one of the warnings. If you don't let it dry, it can be transferred to other people. So you have to wash your hands properly and allow the gel to dry if you're going to use that one. The benefit is you have a daily dose of the testosterone. And if it concerns you about cost, this is one of the most expensive methods to treat testosterone. The next I'll talk about is injection therapy. This is done into the muscle. We teach our patients how to inject into the thigh. They alternate thighs each time. I recommend injecting weekly. So we start out, my starting dose is 100 milligrams or 0.5 mLs every week. It should be done the same day every week. It should be done around the same time. I recommend early evening. The benefit is that you don't have to remember to put it on every day a gel. You don't have to worry about transferring this. One of the downsides is you do have to inject yourself. The other downside is you don't have that daily peak of testosterone. It's a beginning of the week peak and then it drops off slowly across the week. But if we do your dosing correctly, you should not bottom out. You should just have a decline and then kind of go back up in a nice range where you're not going to notice a big change in symptoms or energy, all those kind of things. Other options include longer lasting agents, like a longer lasting injection that's in the muscle called a VEED. This is done in our office. Our nurses will inject this in you. It's in the butt cheek. And once this gets started, you have one injection every 10 weeks. Downside, we cannot adjust the dose as closely or at all compared to the other injection that's done weekly that you do. We cannot adjust the interval. The other warning with this medication, because it's a larger quantity that's being injected, so it's 3 mLs versus the typical 0.5 for the weekly injection, the FDA put a warning that there's a risk that the oil can get in your bloodstream, travel to your lung, and block one of the arteries going into your lung, and it's called a pulmonary oil microembolism. It's very rare, but it's a possibility that we have to be concerned with. After the injection, we monitor you in the office. You hang out, make sure there's no issues for 30 minutes after the injection. The other long-acting method for testosterone replacement is Testopel. Testopels are pellet placed in the fatty tissue. I place them in the flank. They can also be placed in the butt cheek. I just find that there's more fat tissue in the flank and it's easier to do. We place them about every 4 months, give or take a month. And this is something that's just slowly absorbed / broken down by the body. So you get a very long drop in your testosterone, a very gradual drop, and a lot of people like that, and they like that they don't have to do something every day or every week. They like just going to the office every 4 months to get their Testopel, and they go from there to get some labs at 1 month and 3 months. Okay? Those are the main testosterone replacement options where we're actually giving testosterone. But there's alternatives that I actually like better. If we don't have to give testosterone, we don't have to run into a lot of issues as far as drug pharmacy, insurance. If we don't have to give testosterone, we don't run into the issues of insurance company coverage. So clomiphene, we can use it off-label. What that means is it's indicated for something else. It's indicated to get women to ovulate. But because of how it works, it's very advantageous to help men adjust their testosterone levels. And it works because it blocks some of the estrogen receptors in the brain. Estrogen is a byproduct of testosterone. So your body uses this to regulate its own hormone levels. If you have low testosterone, your body typically does not realize that you're low. But you start this medication. If you have low testosterone, your body typically doesn't realize that you're low and your set point is set low. There's not an extra drive to increase your levels. What this medication does is it blocks the estrogen receptors to make your body think that you're low. Again, estrogen being a byproduct of testosterone. Body thinks that you're low, it'll increase production of LH, that's luteinizing hormone, that's coming from the brain, and that's going to go down to the testicles to stimulate more natural production. So the benefit of this, it's a pill that you take every other day. It's going to boost your testosterone without having to actually take testosterone. So it's a natural way. It's not going to impact your sperm function, which every other modality for giving testosterone, by actually giving testosterone, it's going to decrease your sperm function. You may stop making sperm because your body's going to see that extra testosterone there. It's going to be, oh great, we have plenty of testosterone, we don't need to make more. So it's going to stop sending signals to the testicles. So the testicles are going to shut down, the sperm production is going to shut down. So clomiphene, off-label, boosts your natural production of testosterone.